Good morning. This is a presentation of a 54-year-old female who came to the clinic with complaints of cough, persistent cough, with a low-grade fever, she says. Um, so Miss Cody is a 54-year-old, and for the past medical history, she had seasonal allergies that come on every fall and spring, mostly due to trees and pollen. Uh, 2 weeks ago, she attended a conference in Seattle where there was a lot of people, and she noticed that she was starting to have a cough and sore throat and fever, but that went away by itself. But then 2 or 3 days ago, she started having this cough, the persistent cough that was accompanied by pain, substantial chest pain. Every time she coughs, mucus was purulent and green. So she comes in today with mild fever, and the cough is throughout the day, and it does not seem to be worse in the morning or in the night. It's just consistent. She does not have any blood in her sputum, and in the past she's taken Claritin D for allergies that did not seem to help. She's also taken some albuterol, and that seemed to inhale, and that seemed to help a little bit, but not completely eradicate the cough. So as I was examining her today, she seemed not to have any um, swelling of her lymph nodes. Uh, there was no cobblestone in her mouth in the pharynx, and also the ears, cranial nerves all intact. Um, she's a large, she's only times 3, but she complains of dyspnea every time she walks. She's used to walking for exercise, and she cannot walk. She does not have any rashes in her skin, nor lesions anywhere. Um, and the tabinets are pink, but the drainage seems to just be consistent. When I palpated her sinus, frontal and maxillary, she did not. They were not puffy, and she did not complain of any pain. Allergies: she's only allergic to penicillin. In the past, she has a history of depression and anxiety, osteopenia, and insomnia. For medications, she takes calcium D, and she takes a bronchodilator, albuterol inhaler, 2 puffs. She's not allergic to anything other than penicillin. Uh, for immunization, she's up to date with she had her influenza vaccine in January 2018. Health maintenance: she walks. She does not live with a family. She only has a spouse, no, I mean a partner, and he's fine. He's not sick. Family history: great grandparents are all dead, and she's not sure of their death. Mother died of broken hip. Um, uh, Patient is not sure how old the father was when he died of emphysema, um, but she has a brother who's 64 and in good health. Social history includes patient is widowed, never remarried, but has a boyfriend. She drinks 1-2 glasses of wine with dinner, but does not smoke. Uh, Her blood pressure was 122/74, pulse 94, afebrile, cranial nerves all intact, percussion of her abdomen, negative for epigastric tenderness to palpation, and bowel sounds were all gurgly. Lung sounds were all resonance, bilateral, but I did notice some mild wheezing. Uh, Diagnoses include acute bronchitis, viral upper respiratory infection, postnasal drip syndrome, pneumonia, and asthma. Cannot afford to miss is carcinoma of bronchus. Plan is to this bronchitis is self-limiting, and hence no need for antibiotics. Symptom control for now, um, with cough relief lozenges like hot tea, and avoid irritants such as secondhand smoke. Um, for labs, none will be obtained today, but we'll consider uh, diagnostic studies next time if this persists, including getting a CBC and chest x-ray if symptoms do not go away in 10 days. For treatments, just offered warm herbal tea. For prescription, she can take Tylenol 325 milligrams every 4 hours for pain, and albuterol to relieve for bronchodilator. For education, we educate her for the natural history of a cough, and it should go away in about a week. If it does not, to come back, especially if she has a fever, increased fever, and chest pain, and increased drainage of blood in the mucus. So come back to ED or through the clinic. Follow up in 1 week or sooner if the relief do not go away in 10 days. Thank you. That's the end of the report.